are the general coding. There is no guidance here. These are the direct coding, no guidance here. Double line 453, remote monitoring of physiological parameters, weight, blood pressure, pulse oximetry, respiratory flow. So for initial setup and the patient education on use of equipment. So here doctor gives the training for a patient or a caretaker how to use the device, how to fix the device, how to use the device, how to get the data. So everything should explained by our doctor for a patient. So this is a training program. Doctor give training for patient or caretaker how to measure the weight, how to measure the blood pressure, so how to through the entire month. So per month only, we can apply this code. Every month we can apply the code only one time. Every month we can apply the code only one time. We can apply the code only one time. So they are collecting the data from that device through the entire month of readings. And self-measure the blood pressure using device clinical accuracy for validated for clinical accuracy 73. So separate measurement. So 74 for this is the device to self-measure the self-measure the sugar level like that. Two readings 1 minute apart twice a day. So in a single day, they will take 2 times. They will take a test, measure the levels 2 times, 1 minute apart. So these are the training programs. Doctor give the instruction for the patient how to use the device, how to collect the data. And every month they are collecting the data and give the treatment based on that reading. That's it. So these are the general information. That's it. Then same like that, this is a anticoagulant test. Remote physiological monitoring, treatment and management service, clinical staff, physician or other qualified healthcare professional, interactive communication with the patient or caregiver during a month. Here, this is also the code, and for the entire month, we have to apply the code only one time. So for first 20 minutes, 454. For each additional 20 minutes, 428. So this is the monitoring procedure regarding of blood like that for anticoagulant like that. Okay, to measure the bleeding time. Like that. So in all of these tests has been taken in our patient home, not in the clinic, not in the hospital or not in the lab. Patient measure their level in their home and give the information, give the data to the provider. Based on that, doctors give the treatment for the patient. Did you understand, guys? Did you understand? Yes. I mean, only for special ENM service for disability people only. This is a code only for disability people. So physically challenged people, we have to apply the code 99450. Only one code. And this is these two code sections for work-related disability. For work-related disability, 99455 and 99456. 99455 and 99456 for work-related disability. And that means they are doctors giving the treatment. They are giving the treatment regarding of that occupation. For example, patient work in a cement factory. So patient work in a cement factory. For that patient, what type of service we want to give? What type of service? That means. Try. For example, if a patient work in a leather factory means we have to test the patient based on the skin. Because if a patient working in leather factory means they definitely suffered by skin disease. So for that patient, we are giving a skin related test and a skin related evaluation. Suppose if a patient work in cement factory means what type of service would you report? Would you give? Am I right, guys?
Yes, ma'am.
Okay. So for that patient, we have to report the code for respiratory related evaluation. Okay. You are a coder. If you are going to meet a doctor regarding with some problem regarding your work, so what type of service will given for you? For medical coders and for software engineers and for driver. So for medical coders and the software engineer, they give a evaluation regarding of back pain and regarding of eye. Am I right? So these two people are suffered by eye problem and back pain because they are continuously using the monitor, seeing the monitor. So that's why the eye will. That means a patient has suffered by some eye problem. So can we give this treatment for cement factory patient? Can we give this treatment? Is it suitable for that patient?
No.
So no, because here we are giving the assessment, we are giving the evaluation based on the work, based on their occupation. So that's it. That is work-related disabilities. The newborn, very, very, very important. So before that, first from newborn, as a very, very important, the newborn period is 0 to 28 days. So 0 to 28 days period is considered as a newborn. If a newborn admitted into the hospital or birthing center, on the day of admission, go for 999 460. Newborn admitted into the hospital, on the day of admission, go for 999 460. And for the subsequent day, go for 62. If a baby admitted into the hospital on the day of admission, 999 460. From the second day, go for 999 462. Second day, third day. For the subsequent day, 462. On the day of discharge, we should apply. See the last three lines of paragraph. See the last three lines. For hospital discharge service, provide on date of subsequent to the admission, see 99238 and 30. If a newborn has discharge from the hospital means we should apply 99238 and 30. We already discussed that. 99238 and 30. Inpatient discharge code. See that 99238 and 239. So 99238 and the 239 code would you apply for on the day of discharge for newborn. Okay. So if a newborn admitted into the hospital means we have to apply these three codes. Suppose if a newborn admitted in other than hospital means go for 999 461. Newborn admitted in other than hospital or birthing center means go for 999 461. 999 463 if a newborn admitted under discharge on the same day. If a newborn admitted under discharge on the same day means go for 999 463. Newborn admitted under discharge on the same day means Go for double line 462. Did you understand these four core sections?
Yes, ma'am.
Then this is a code for birthing room, delivery room. This is a code for birthing room, delivery room, labor ward. It's also called as labor ward. Baby, that the newborn is present in that delivery room after birth for a few minutes for initial stabilization. So after delivery, doctors keep the child in that room for initial stabilization. So they are examine the patient, if they are examine the newborn's breathings, respiratory levels, and they are also checking the function of lung also. For initial stabilization, baby is keep in that delivery room after delivery. For initial stabilization. Suppose if a baby has any chest compression or pressure ventilation, means they are providing a ventilation for few minutes. So 44 for without any ventilation, baby keep in that delivery room for initial stabilization. During that period, they are examining the function of baby's lung, respiratory level, everything. But in double line 465, baby has a pressure, chest compression or pressure ventilation. So that's why baby can't able to breathe well. That's why baby can't able to breathe well. That's why they are giving a ventilation procedure for stabilization. So in that case, 465. Without pressure ventilation, chest compression means 464. Suppose if a baby has a pressure ventilation, chest compression means come to the double line 465. Did you understand? These two core sections for reporting of in which facility? In which facility?
Birthing room.
Labor ward. Okay, labor ward, delivery room or birthing room. Then inpatient neonatal intensive care unit. So here we have a code. So we already discussed about critical care service. We already discussed about critical care service. Those codes for adult. Now we are going to discuss the critical care service code for pediatric. Neonatal critical care like that. Now, in this pediatric critical care patient transport. So patient is transferred from one facility to another. That means from one hospital to another, or one state to another state, one city to another city, whatever it is, patient is going to transfer from one location to another. Here, doctors also travel with the patient, means go for 66 and 67. If patient also travel with the patient, doctors also travel with the patient, means go for 66 for first 30 to 74 minutes. For each additional 30 minutes, double line 467. So here they are doctor giving a face-to-face service during the travel. Doctors also travel with the patient, but in 85 and 86, doctor do not travel with the patient. So he communicate with the doctor, communicate with the transport team, and perform the service. That's it. 66 and 67, patient with the patient, doctors also travel. So they are doctors giving a face-to-face. Doctors giving a face-to-face service. But in 85 and 86, doctor do not travel with the patient. So he communicate with the transport team and give the instruction. So same like that, for first 30 minutes 485, then each additional 30 minutes 486. So before you are going to report any of the critical care transport service for pediatric means, first you have to check the presence of doctor, physician. You have to check the presence of physician. If a physician is present during the travel means go for 66 and 67. Doctors do not travel with the patient means go for 85 and 86. Did you understand now? Very, very important question. If you have any doubt, please ask. Shall we move to the next?
Yes, ma'am.
Then this is a neonatal critical care, inpatient and the neonatal critical care. Baby admitted into the critical care units due to any severe illness or injury. Due to severe illness, critically ill or injured condition. So if a baby neonatal period is 0 to 28 days, guys. Neonatal period, newborn, neonatal, both are same. Take a note. Neonatal period is 0 to 28 days. That means from the birth through following 28 days. Birth through following 28 days are considered as neonatal period. If a neonatal is admitted into the critical care on the first day and the time of admission go for 468, 469 for subsequent day. On the time of admission go for 68, for the subsequent day go for 69. 29th day to 24th. Up to 28 days, patient is considered as a newborn. Up to 28 days, patient is considered as a newborn. From 29th day, patient is considered as an infant. So from 29th day to 24 month, first day 71, each additional day 72. So here we are reporting the critical care code based on the patient age. Based on the patient age. Then 72 and 75 72 for subsequent, 71 for initial, 72 for subsequent. Now check that the age of 75 and 76.
2 to 5 years.
Check the age of 75.
2 to 5.
2 to 5. Okay. Guys, is there anybody waiting in lobby? Means please let me know. Yes. If a patient age is from 2 years to 5 years, go for 75 for initial day, then 76 for subsequent day. 75 for initial day, 76 for subsequent day. Okay. Suppose if from 6 year and older. From 6 year and older means we have to list the corresponding adult critical care. So these one. We already discussed in our last session, critical care service. 99291 and 99292 for from 6 year and older. From 6 year and older patient, we should report the critical care code from 99291 and 99292. Did you understand, guys? Yes. Because patient has a very critically ill or injured condition. So then only we can apply the critical care code. Then only we can apply the critical care code. After birth, if a patient after birth, if a baby is admitted into the critical care, today only baby born. On born day, he admitted into the critical care means we have. Guys, a meeting will go in. This is not a critical care, intensive care unit. What is the difference for critical care and intensive NICU? NICU means neonatal critical care unit. injured condition is baby admitted into the critical care unit. So in NICU, baby do not have any critical condition. He just want a initial stabilization only. He admitted into that NICU. For example, low birth weight, premature baby and low birth weight babies are admitted in this NICU. I think everybody know that incubator. I think everybody know that incubator. Incubator is nothing but is a neonatal intensive care unit. So they place the patient for initial stabilization only for premature infant, late born, for premature infant and low birth weight babies are admitted into the intensive care unit for initial stabilization. So for example, but a patient do not have any critical or illness or injury. Baby does not have any critical or injury condition. So if any critical or illness or injury means go for critical care. The baby has any critical illness or injury means go for critical care. Otherwise, you have to apply the code from intensive care unit. So 99477 for initial on the day of admission. So what is the age criteria for this code section? Check that. What is the age criteria for 99477 code section?
28 days or younger.
Age or younger. Yes, or younger. Super. For 28 days or younger people, we can apply this code. On the first day, 99477. For 99478, for subsequent day, if a baby weight is less than 1500 gram. Less than 1500 gram. And for 99479 for from 1500 to 2500 gram. 99480 2501 to 5000 gram. According to the weight of the baby, you have to select the appropriate code section here. Okay, so these code section for intensive care units. Okay, now newborn has suffered by the problem of jaundice. So in this case, this baby is admitted into the intensive care or critical care. Intensive care, because for newborn jaundice is not a critical condition. It's not a critical condition. Okay, so newborn jaundice is not a critical condition. That's why baby will admitted into the intensive care unit. If a baby has any congenital septal defect, here where does the baby is admitted here? Critical care, because septal defect is a very critical condition. So that means that is a life-threatening condition. So that's why baby will admitted into the critical care unit. Did you understand this, guys?
Yes, ma'am.
And these are the very direct one. Cognitive assessment, a care plan service. So this is nothing, but this is not important also. Actually, they are taking the assessment how to take care of the patient. What are the things we have to follow? Cognitive assessment and care plan service. They are preparing the planning for the treatment. They are properly preparing the planning for the treatment. They are getting the assessment based on the patient age, based on the patient health record, based on the patient condition. They are taking this is for all of the disease condition. Suppose if a patient is suffered by brain tumor means, so before they are going to take surgery or after completion of surgery, they are taking some assessment how to how to handle the patient, what are the things we have to follow to cure the condition. So everything should be taken in the assessment. So that is called as cognitive care plan assessment service. That's it. Because for example, if after completion of brain tumor, patient still present in hospital for 10 days. So in these 10 days or during after the post-operative period, doctor takes some assessment. In that assessment, they are planning the treatment, they are planning the medications, and they are planning for the follow-up. Everything should plan during the assessment, and they create a plan and they get the assessment. So for that assessment, doctor spend the time. Am I right? To take these assessment, doctor definitely want to spend their time. So for that service, here we are reporting cognitive assessment and care plan service. So care management service. This is a very, very important. Chronic care management service, complex chronic care management service, principal care management service. These are the classification of chronic care. Actually, management is nothing but they are taking care of the patient to recover from the condition, or they are prevent the condition for prognosis. Okay. For example, chronic care management service. What is the duration of chronic condition?
12 months. More than 12 months.
That means at least 12 months. At least 12 months until the death. Okay. Is there anybody waiting in the lobby? Until death. So that is the duration of chronic condition. Here they are taking the assessment. They are giving the service for that chronic condition. Okay. They are taking the service, the doctors giving the service for a patient to cure the condition, to cure the chronic condition. Here in this, under the supervision of provider, if clinical staff perform the procedure, means go for 90 under 99439. Chronic management care service. The service under the supervision of doctors, staff nurse here perform the service. Under the supervision of doctors, clinical staff will perform the service. Here for first 20 minutes 99490, then each additional 20 minutes 99430. First 20 minutes 99490. For each additional 20 minutes 99430. Then 99491 and 99491 and 37, the service given by the doctors. Okay, here guys, please listen. 490 and 430 service provided by clinical staff. So, but 99491 and 99437 service provided by doctors directly. So, same like that, for first 30 minutes 491, each additional 30 minutes 437. First 30 minutes 491, each additional 30 minutes 437. And this is a core section for complex chronic condition. So here complex chronic condition is nothing but the condition has now in a severe stage. The condition is now in a severe stage. So that is complex chronic care management service. So don't worry, doctor directly denote that the severity. So doctor directly denote the severity. So here the term complex that denote the severity of the condition. Severity of the condition. For first 60 minutes, here also The service given by clinical staff under the supervision of doctor. Service provided by clinical staff under the supervision of doctor. Same like that, for first 60 minutes, 99487. Each additional 30 minutes, 99487. So these two core sections are complex chronic care management service and principal care management service. Principal means that is condition is not a chronic condition. It's one of the acute condition. It's not a chronic condition. So chronic means at least 12 months until death. Am I right? Here, check the duration of that. At minimum, at least 3 months. Patient has suffered by the problem at least 3 minutes. 3 months. Acute condition. So they are giving the service. They are giving the service for acute condition to protect from the chronic. They are giving the service for acute condition to protect. That means they are prevent from the chronic condition. So here, same like that, the service provided by doctors. First 30 minutes, 424. Each additional 30 minutes, 425. If the service provided by doctors means first 30 minutes, 424. Each additional 30, 425. And 99426 and 27 for clinical staff. Under the supervision of doctors, clinical staff will provide a service, same like that. First 30 minutes, 426. Each additional 30 minutes, 425. These are the very, very direct coding, but important because these services are regarding further chronic condition and to prevent from the chronic condition. Did you understand?
Ma'am, your screen is not visible.
Sorry? Screening not visible. Am I right? So that this is a service regarding a mental related disorder, psychiatric collaborative management service. So here they are giving the assessment, doctor giving the assessment regarding a patient mental related disorders. So if a first day, initial day, so the care management given by the doctors on the first day at the initial service 492. For subsequent service, if this is a first visit with the doctors means go for initial service. From the second visit, you go for subsequent. So on the first, for initial means this is a first time service with the patient. Subsequent means from the second visit we should consider as a subsequent. Here for first initial means the time duration is check that the code description. First is 70 minutes. Second, check the second line. Initial psychiatric collaborative care management. First is 70 minutes. For first is 70 minutes initial 99492. Then first is 6. For subsequent means it will be a 60 minutes. For initial 70 minutes. For subsequent means that is 60 minutes. Apart from these time, these virginal time, if doctors spend extra time means actually we have a add-on code also here. We have a add-on code apart from I think 994, I think so. So apart from these virginal time, suppose if a doctor spend extra time means we should report a corresponding add-on code for a psychiatric collaborative management service. I think 99490.
Yes, ma'am.
Okay. So apart from these 60 minutes, 75, apart from these 70, apart from these 60, if doctors spend extra time means for that extra time we should report the corresponding add-on code 99490. 93. Okay. So the slide is same. Same slide is present in both of that. Okay. Transitional care management service. So this is a one like a nursing facility. This is also the one of the center. So patient admitted into the center, and if a patient admitted into the transition, guys, as I told you already, for the entire ENM service, they have to apply the code based on the place of service. Here, the place of service is transitional care management service. That means center. So in that center, patient admitted. So if a patient discharged within 14 calendar days, means go for 495. So here the medical decision making would be moderate. Check the second and the third point. In 99495, MDM, medical decision making will be a moderate. Or a patient will discharge within 14 calendar days, 14 days. But in 96, what is the MDM? What is the
High.
MDM? High. For high MDM, high. For high MDM, if a patient is discharged within 7 calendar days, means go for 496. This is a transitional care management service. That's it. Advanced care plan management service. Advanced care means doctor follows some treatment. After, if the treatment is but still now patient receive the problem, means doctor take the decision to give a advanced treatment for the patient. For example, for infertility, doctor gives the treatment, give a one treatment method for 6 months. Okay, doctor follow a single. Yes.
Can you speak loudly, ma'am?
Others, am I audible?
Ma'am. Yeah, ma'am.
Yes, ma'am.
Am I audible? For everyone.
Yes,
Yes,
ma'am.
ma'am.
Yes, ma'am.
Audible, ma'am. But
It's a single treatment method for 6 months, but that is no improvement. So that's why they will take the decision for advanced care of IVF, IUI. Okay, so before they are proceeding the process, they are communicating with the patient and their family, and they explain the advanced care plan, explain the advantages of advanced care, and every detail should explain during that session. Okay, for that service, face to face with the patient and their family. In this, during that time, they are explaining, that means doctor explaining the advantages of advanced treatment method. What are the advantages? What are the disadvantages? Everything should explain during that time. Okay, so in this, for 6 months, doctor follows some medication for a patient. So there is no changes, no improvement. So that's why they are just taking the decision to give a advanced procedure, because if that treatment will, if a doctor will give a advanced treatment, means the cost will is also high. So that's why they are communicating with the patient. For first 30 minutes, 99497. Each additional 30, 99497. For first 30 minutes, if they are communicating with the patient, family, and the patient and their family, for first 30 minutes, 497. Each additional 30 minutes, 490. Did you understand? Integration of care management. Okay, this is also the health behavioral, means like they are taking the assessment if a patient is addicted for some alcohol, they are dependents. So they are planning the treatment. How to how to, for example, if a patient is a alcohol dependent or a drug dependent patient. So for that patient, they are taking the assessment and they are planning the treatment session. They are planning the treatment method, planning the medication, everything should be planned during the period, and they are implementing the service also. They are implementing the service also. So this is a code part. So with here, this assessment would taken under the supervision of doctors. Usually the service given by staff nurse under the supervision of doctors. 99482. That's it. So this is a unlisted procedure code for evaluation and management service 99482. Actually, if you are going to report any of the unlisted procedure code, not only for this chapter, you must need a guidelines. Our guidelines should inform them. You can't able to report the unlisted procedure code frequently. Based on the guidelines only, we have to select the unlisted procedure code. That is important. So ENM over. Any doubt? Any question? Any question?
Yes, ma'am.
Yes, what's your doubt?
Ma'am, transitional care, can you explain it?
Additional?
Transitional care.
Advanced care. Sorry, your voice is not clear. Yeah.
Ma'am, transitional care before advanced care planning.
Transitional care. Okay. Transitional care means this is one of the facility like a center. Okay, like a center. In the center, patient admitted in that center means you have to check here. Don't worry. So the place of service directly documented by providers. Don't worry. Place of service directly documented by providers. So now, for example, patient now in a kidney failure, so no chance to save the patient life. So in that case, they are admitted into this transitional care management for service. Because they are going to live for few days or few months only. So in the center, they are giving a treatment as well as they are taking care of the patient, and they are give happiness for that patient. Okay, they are giving a entertainment like that. So because they are counting their days, but in the center, if they are admitted means that centers, that nurse, that means the trained professionals or nurse, they are taking care of the patient as well as they are giving the treatment also, and they are giving a entertainment related activities, entertainment for that patient also. They are making a patient become happy. Did you understand now? Here you have to apply the code based on the MDM. For moderate MDM, the patient discharge within 14 calendar days, 495. Then 496, high MDM, patient will discharge within 7 days. That's it. Did you understand now?
Yes, ma'am. Thank you.
Now I'm going to ask questions from that table. After that, I will going to ask the question from this table, because as I told you already, you have an idea also. Most of the 80% of ICD ENM guidelines are based on this table one. So now read the level of straightforward and low. If you have any doubt, please ask immediately, because I give 5 minutes for you. Read the entire table. That means you just read these two levels only. After that, I will ask some question from this level, from these two levels. Okay. First, is there any doubt in these two levels? Any
No,
doubt?
ma'am.
Okay. Take your own time. I give a 5 minutes for you. So read the documentation, understand the meaning. After that, I will ask some questions regarding of these two levels. Example, based on that, try to fetch the corresponding levels. Okay. And you have to explain which point is satisfied for this example and why here you are selecting this level. You have to explain that. Okay. Now, patient has a problem of cough and cold. So doctor prescribed OTC. What are the levels not satisfied? What are the levels?
Low level.
Lower level.
Why? What are the points are satisfied here?
Cough and fever, 2 or more self-limited. Minor problem.
OTC.
OTC drug.
Super. So cough and cold. So these are the two minor problems that are satisfied in table A, and for OTC means that is table C. So two columns are satisfied in the single level. So that's why here we are taking the level of low. Okay. Now, so now I give an example. So you have to check what are the points are satisfied here. Doctor, review the patient previous record of diabetes mellitus. Doctor, go through the patient previous diabetes mellitus health record, and now a patient doctor order blood test and urine test. What are the points are satisfied? And
Low level category 1, ma'am.
Category 1.
Category 1.
One, what are the points
And
are
it
satisfied?
2 combination. Review of prior external and ordering of injury test.
First point and third point. And ordering of each
Order
unit.
of each unit text.
So I am giving in this example, how many points would you get?
2 combinations.
2. So doctor order the two is necessary. 2 is enough. But in my example, how many points you get?
3.
3.
3, ma'am.
3, because doctor review the prior external note and order 2 tests. Then each test will get a 1 point. So totally 3 points. We need 2 points only, but our example satisfied the 3 points. Okay, now I am a patient. I have a high fever. So I am going to meet the doctor with my mother. I can able to speak, but I am not interested to speak with the doctor. So my mother explained my health conditions. Can we get this? Can we get it as a category 2?
Yes, ma'am.
Yes, others. Again, I have a fever.
No, ma'am.
No. Why?
Because one is stable condition.
Independent historian and one stable condition.
Actually, independent historian means my mother. My mother explained my health condition, but you do not give the point for that. You do not, because I can able to speak. But I'm not interested to speak with the doctor. That's why my mother explained my health condition. So in that case, you did not give the point, and it does not solve the category 2. So when we give a point for independent historian means patient can't able to speak. At the time only, independent historian will explain the patient problem. But in this scenario, I can able to speak, but I am not interested. So here you should not give a point for category 2. Clear now? For example, 3-year-old baby. Okay, can that baby can able to explain their health condition?
No, ma'am.
No.
No, ma'am.
Independent historian will give a assessment. So we can give a point because patient can't able to speak, can't able to explain their condition due to age or due to sickness or due to a patient in an unconscious state. Patient is a 55-year-old, but patient in an unconscious state. So that's why patient can't able to speak. So in that case, we can give a point for independent historian. But patient can able to speak, but not interested to speak with the doctors. We do not give a point for that. Clear now? Any doubt in that?
Okay, ma'am. No, ma'am.
Okay. Now after that, I told you guys, I give a example for parenteral substance. Once I complete that, I will give you. I show that PDF page for you. Take a note of that. Now, start your time. Read the moderate table, level of moderate. I'm going to ask you a question from this. With the COVID-19, so doctor order to confirm that doctor order nasal swab test and blood test, and interpretation also discussed with that ED physician, and then finally they are giving a IV infusion for that patient. What are the levels are satisfied? What are the points? Patient is a COVID-19 patient. Okay.
One acute illness with the systemic symptoms.
Okay. One acute illness with the systemic symptoms. Super.
Ma'am, category 3 for interpretation.
Category 3 for interpretation. Interpretation means that will go for 2. Interpretation discussed with another physician means that will category 3. Okay. Here doctor discuss that result with another doctor. So that means that is category 3. How many tests here?
To order it, test category 1 also, no, ma'am. Category 1 and category. Yeah.
Category 1 and 3 are satisfied here. For category 3, how many points we need? Sorry. Here, in these 3 categories, we need any one category. Okay. So, doctor ordered 2 tests, nasal swab test and blood test, as well as the previous test result has been discussed with the doctor. So, here, 1 minute, here, ordering of test that satisfied the category 1. Am I right? Another physician that category 3.
Category 3.
Yes, but for category 1, how many points we need?
2 points are 2 tests, no, ma'am.
2 tests. 3 points.
3 points.
3 points. But our document support 2 points only. Category 3 is also satisfied here, so no need to check the don't care of that category 1. From the category, any one category should be satisfied. Category 1 is satisfied, but for 2 points only. We need one more point, but no need to check because it automatically is, the document is automatically satisfied the category 3. So I have no need to check the category 1 and 2. And it is given. Which point is satisfied?
Sorry, ma'am, we cannot hear you.
IV infusion is given.
Okay, ma'am.
IV infusion given means which point is satisfied in which level?
Ma'am, drug management. Treatment, ma'am. Diagnostic, I mean, table C.
Actually,
Third
go
point.
back.
Diagnostic or treatment significant.
Parenteral control. Drug therapy, parenteral control. So IV infusion is given means that is satisfied in high. That is satisfied in high. Am I right? If doctor give any IV injection or infusion means you should consider as last point. Parenteral controlled substance. Here, two categories, two columns are satisfied in moderate. One column satisfied in high. So, as per our coding guidelines, how many columns should be satisfied?
Two, ma'am.
Two columns.
Are directly satisfied in moderate. So, the level is also go for moderate. Okay? Because sometimes they will ask some questions. So, one column satisfied in, for example, here in this example, two columns are automatically solved in moderate MDM. One column, that means table C satisfied in high. But as per our guidelines, I give one more example. How many category we want to report this high? Two category. 2 out of 3.
Right.
Okay, now I give one more example. Patient has 2 stable chronic illness. Patient has 2 stable chronic illness. Okay, and the doctor review the 1 minute. Okay, patient has 2 chronic illness, stable. That means patient has controlled diabetes mellitus, controlled hypertension. So doctor also review the previous test report for a blood test and urine test. Patient today meet the doctor with controlled diabetes mellitus and controlled hypertension. Doctor review the previous test result, test report. 2 tests, blood test and urine test.
Category 1, ma'am.
1 minute. So, previous test result has been reviewed in this visit, as well as IV infusion is given. IV infusion is given for that patient with the monitoring. What are the levels that are satisfied?
Moderate high. Category 1. Moderate and high.
Actually, moderate. In moderate, which one is satisfied?
Category 1. Category 1. Stable chronic illness.
2 are more stable chronic
illness.
And category 1 not satisfied, because for category 1 we need 3 points, but I just give it 2 points only. Review the previous blood and the urine test. So that is satisfied in the table of low MDM. Am I right? Low MDM. Am I right or not? Doctor review the current test result of urine and blood. So 2 tests, so it will get 2 points. So category 1 is satisfied in low. And IV is given. So that is satisfied in high. So table A satisfied in moderate. Table B satisfied in low. Table C satisfied in high. So 3 different tables are satisfied in 3 different levels. How can we fetch? Means choose the middlest one. Choose the middlest one. So low, moderate, high. So from these 3, which one is the middlest one?
Moderate.
Moderate.
So code for moderate. Then one more example. Straightforward, low, moderate. From these 3, which one is the middlest one?
Moderate. Moderate.
Low. Straightforward and moderate mean low is the middlest. So this is one of the example. If 3 tables are satisfied in 3 different level means choose the middlest one. Suppose 2 tables are tasked, that means table A, table B and table C. From these 3, any 2 tables that are satisfied in different level means, for example, table A satisfied in low, table B satisfied in moderate means choose the lowest one. 2 tables are satisfied in 2 different level means choose the lowest. Comparing with the moderate and low, which one is the lowest intensive procedure? Intensive
Low.
Low MD.
Low.
One column,
Oh,
another column satisfied in high means which level would you report?
Moderate.
Moderate. One column satisfied in moderate, another column satisfied in high. Comparing with these 2, which one is the lowest one?
Moderate. Moderate.
Did you understand?
Yes,
Did
ma'am.
you understand, sir? Okay. Now, take this example for parental controlled substance. So, these are the example for parental. If you are seeing any of this injection in your document, consider as a IV parental substance.